All right, let's see if that's better. Can you see it now? All good?
Yes.
Excellent. Okay, so why must we talk about preventing overdose? 75% of employers have been directly affected by opioids. And so that's a large number of employers who have been affected by opioids. And that's why we need to talk about this. In fact, in Connecticut, according to the Department of Public Health, you are more likely as of 2022 to die of unintentional overdose than you are to die in a automobile accident. And that's a sobering number if you think about it. So that means that there's a wide ranging of effect of how substance use affects individuals. And so this is why we need to talk about it. And we're going to get into some more specific numbers as to how the impact is amongst employers and employment for those in recovery and for those who are using substances. So the risk of substance use affect every workplace. It's a serious public health issue. We have coworkers right beside us who are in treatment and recovery. In fact, if you were to look to your left or look to your right, one of the three of you has either been directly affected by substance use or are in or have had substance abuse issues. So it's a wide ranging of people. And as you know, most of us work. Those of us who are in work, this is a very serious situation. So the industries that are most affected include the constructions and the trades, the services including food service, transportation, installation, maintenance and repair, sales, entertainment, sports, media, communications, production, machinery, setters, operators, tenders, executive, administrative, managerial, financial, and farming, fishing, and forestry. So it's a wide range of occupations that affect of individuals who are affected by substance use in the workplace. Some of the sobering information of the impact on employment and employers. 16% or 46 million individuals nationwide met the criteria for a substance use disorder. Ooh, sorry, 7 out of 10 adults have had a substance use problem considered themselves to be recovering or in recovery. 2 out of 3 adults have had a mental health issue considered and or considered themselves to be in recovering or in recovery. 9% of working adults have a substance use disorder. And so that's all from 2021 NSDUH data reports. And so what is the impact on engaging in a recovery-friendly workplace? So here are some of the benefits that an employer can expect to come to if they embrace this recovery-friendly initiative. Workers in recovery help employers avoid, on average per year, $4,088 in $488 in turnover and replacement costs. Workers in recovery miss 13.7 less days per year than workers with a substance use disorder. Saves a company over $8,500. Now, some of those savings are based on training a new employee, right? They're based on exiting an employee, paying severance, vacation, whatever payments might be made upon separation. So those are all reasons why employers should be engaging in having a recovery-friendly employment. So what is a recovery-friendly workplace? We've heard about it. We hear about it all the time. What does it mean? So these are businesses that go above and beyond in supporting employees by making foundational changes in the way they hire, treat, and support staff living with or seeking recovering from substance use and mental health concerns, as well as those family members and loved ones who are also impacted. There's a number of reasons why employers decide to go and decide to become recovery friendly. Better performance, fewer accidents, greater loyalty, higher productivity, less turnover, lower healthcare costs, employee retention, and reduced costs to train new hires. 21 million plus people in the US are in recovery for a substance use disorder. And so being in recovery removes the stigma that's associated with that. And also, it's very important to remember that being honest and open in communication as an employer with your employees also will allow you to have a better relationship with those employers and in the end save you money by becoming recovery friendly. And we'll go into the steps that are required for that in just a few minutes as part of this overview, but I just wanted to mention that. So in Connecticut, our recovery-friendly workforce initiative strives to help workplaces that create a culture that promotes wellness and supports recovery through positive engagement and open communication. In fact, not only are we working with employers, but we're also promoting recovery in local communities by having recovery-friendly communities. We're also trying to create what's known as a stigma-free ecosystem in which employees thrive. And we're trying to retain healthy and productive employees. And we're also trying to reduce, by the way, the number of accidents on site, especially in the construction trades. When you look at the construction trades, and if those are individuals who are who and if that accident involves some kind of an individual who was engaged in substance use, then that's an issue. And so we're trying to prevent that. And the way to prevent that, one of those ways to prevent that, if you're an employer, is by instituting this recovery-friendly workforce initiative. So what are the employer benefits? And I just kind of mentioned a few of them. But in 2022, 43,200 workers were identified as having a work-related injury or illness in Connecticut, according to the Bureau of Labor Statistics. 19,600 were cases with days away from work. And there's a potential that a lot of those could have involved treatment with opioids, right? Why aren't they at work? That's one of the reasons. And so all of these reasons on the right-hand side show some of the advantages of instituting a recovery-friendly initiative. We want to promote employee satisfaction. We want to boost attendance and productivity. We want to promote community connection, and we want to have improved health and wellness. The second topic of our agenda was the recovery-friendly workplace process, culture, and strategies. And so to get to this, we're going to just give you a little highlight of where this all began. How did our three agencies begin working together towards moving towards a recovery-friendly initiative? And it all began in 2017 when the Department of Public Health and Deb Pease, who was actually on this phone call, conducted a symposium and published the Opioid Crisis in Connecticut's Workforce Report. Then in 2019, the Connecticut Department of Labor applied for and received a national dislocated worker grant that was an emergency grant in the United States. At that time, the President of the United States declared the opioid crisis a national emergency. And so as such, we applied for money, and the Department of Labor received $4.5 million to implement a recovery-friendly workforce initiative. Around that same time, the Department of Mental Health and Addiction Services and the Alcohol Drug Policy Council actually partnered with us to align our agency goals and objectives. We found out we were both aiming for the same goals, and we said, why not work together? And we added the Department of Public Health as well. And so the three of us began this wonderful journey. And it has been a wonderful journey because I feel you will not often see the kind of camaraderie and the kind of partnership in state agencies that our three agencies have built with this particular initiative. In 2020, we actually worked with DEMIS and the Alcohol Drug Policy Council to develop a recovery-friendly workplace toolkit. And we'll give you a little glimpse of that in just a minute. But we also had some recovery-friendly work coordinators who were hired to roll the recovery-friendly initiative out at that time. In addition to that, the Connecticut Department of Labor hired peer navigators and placed them in each of our American Job Centers. Those navigators are individuals who have lived experience. And what we found is that individuals who come looking for work, if they have had substance use in their past, or if they have family members who have been tell us at the Labor Department that that's an issue that they have. So what we did is we hired peer navigators with lived experience to work with those individuals so that we could remove the barriers that they face before we make a job placement or before we put them into employment so that they could be more successful. And that was one of the main things that we did with the money that was available. Since then, we've implemented recovery-friendly work coordinators in all of our communities throughout the state. We've had mobile employment specialists through DEMIS, and we've began a campus initiative as well. So the opportunity here was that our initiative encouraged healthy and safe working environments where employers, employees, and communities could collaborate and create positive change, eliminate stigma, and support recovery. It's an opportunity for our state agencies to lead and champion this work. What I have before you now, this next slide will show you a part of our Connecticut Recovery Friendly initiative. There are several steps that an employer would take to become recovery friendly. The foremost and most important part is to go to our website, drugfreect.org, where you can get all the information you need in order to become recovery friendly. You can download our toolkit, and you can also work with both individuals who have been employed by DEMIS and who have been employed by the Connecticut Department of Labor as peer navigators to work together to actually implement that recovery friendly initiative within your within your work site. And if you do that, you can then receive that official designation from the state of Connecticut, from the governor, that you are indeed recovery friendly. So some of the steps that it takes to become recovery friendly is doing an internal assessment, looking at your policies, looking at your procedures, going over that, seeing how you can make changes to more align them with stigma-free and recovery-friendly ideas. You can build a consensus within your workplace by talking to your supervisors, by talking to the person who is head of the employer, the chief financial officer, whoever happens to be the head of that company, and telling them about this initiative and trying to get them to work with you on it. Another one of the things that we have here is you can make a declaration. You have to make a declaration and say that your company is going to be recovery friendly. You then work with us to work through the rest of the steps. You designate a peer champion within your company. That person is the person that individuals would go to if they're having an issue with substance use, or they have a family member who has an issue with substance use. One of the things that we do work with very closely is we work with the Connecticut Community for Addiction Recovery, CCAR. Their website has a wealth of information that employers can use on preventing and treating individuals with substance use and how to work with them in the workplace. And so that's one of the places that we can help send individuals to take a look at and see what kind of resources are there. There's pamphlets, videos, and all kinds of information that individuals can take guide of. Also working with our regional behavior health action organizations, individuals can get direct help for substance abuse issues. If they need to be placed in a bed, if they need to have in-treatment patient services, we can help them get that while they're doing that and while they help to get to recovery, which is the ultimate goal, obviously. And then, of course, like I said, we have our peer navigators in the American Job Centers. One of the things that another one of the steps in this entire process is to make resources available to individuals, to employees. Training and education, very important. You provide some training and education. Thank you for your question. I'm just seeing that right now. I don't have any statistics that show the number of people who should be in recovery and aren't. That's a very good question. That might be available on the NIOSH site or some other website. I don't think that that's something that was covered in Deb's paper that she presented, but I will also give you a little idea of the recovery-friendly landscape moving forward and some statistics around other states and how they're moving forward and how this is just taking shape. This whole recovery-friendly idea in employers is just taking shape nationwide. And Connecticut is really leading the way. We're one of the states that are leading the way, along with New Hampshire and some other states. And so some of the other things that we're doing is you can do an annual assessment if you're part of the employer, and then we advise you to keep going. And these are all the steps that are involved, but we will assist you and help you to get that official designation.
Rob, is this a good place to jump in? I know you can't see when you're presenting. I have my hand up. So I just wanted to make sure before.
Yep. Oh, sorry, Commissioner.
That's okay. Before we get kicked out, I wanted to make sure of some acknowledgements. First, you deserve a huge amount of acknowledgement and appreciation, especially within our agency, because you have been the driving force in the Connecticut Department of Labor since 2019 on this. So, you know, thank you. And I want to make sure that everyone else is aware of your passion behind this project. I also wanted to mention, when we talked about the peer navigators, you mentioned that, that there was also a lot of work with interagency with the Office of Apprenticeship, so that those peer navigator positions
Yes.
would be registered apprenticeship positions, and you know, further that career development pathway for those folks. So that was huge, and thank you to you and to Todd Birch for working together. And lastly, I want to acknowledge the you did mention the AJCs, but for folks who don't know all of our acronyms and terminology, the workforce development boards in all 5 regions partnered with us in the American Job Centers and hired the peer navigators. So they were also a very important piece of the collaboration to make this work. So I know you're trying to get a whole lot of stuff in a short period of time. I just wanted to make sure that we got in all those acknowledgements as well. Thank you.
Yeah, thank you, Commissioner. You're absolutely right. And in fact, we do have a slide where we talk about the fact that Connecticut, absolutely, we were the first state to develop peer navigator apprenticeship in the country. And so that's an awesome thing that we did, and that's something that Todd Birch and I worked very hard on. And it's a great example of how you can expand apprenticeships to non-traditional apprenticeships. You wouldn't necessarily think, oh my God, let's, you know, a peer navigator, they could be an apprenticeship too, and they can. So that's a great example of that. And so thank you. I appreciate that. And yes, we could not do any of this work without any of the help of our workforce development boards, who help to fund all of our programs and provide the on-the-ground training. And in fact, you're going to see that some of our workforce development boards are actually designated by the governor as recovery friendly, which is great too. So thanks for tying that all together. I appreciate it. You're right. Trying to get through a lot in a short period of time. So recovery friendly Connecticut, I'm going to just quickly just indicate that, like I said, we're on the leading edge of this work. Employer buy-in, stigma, those are some of the things that we're up against. 2/3 of the states don't have an established recovery friendly work program, but we do. Resources for outreach training of employers, unions, and communities are lacking. Most don't engage in job placement. We did during the National Dislocated Worker Grant. We actually placed individuals, and only 70% of respondents addressed prevention of workplace injuries as part of their services. So in Connecticut, we're kind of leading the way, which is really exciting. And so yes, I mean, yes, it is. I'm very passionate about it, but I couldn't do it without the support of all 3 agencies, my commissioner and all commissioners and everyone, and including the governor's office, who helped us with this. We talked about the development of the toolkit. We talked about peer navigators. We talked about collaboration. We talked about the community recovery-friendly communities and campuses. And we talked about the creation of the shared mission between our 2 agencies. The next exciting step for us is that we're going to be looking to see if we can't get Connecticut state agencies designated as recovery friendly. And the first 2 that are working together and have been working on getting there is our department at the Connecticut Department of Labor and the Department of Mental Health and Addiction Services. And so we're going to be working very hard towards moving that way to try to do what we need to do to get that designation. And so we're excited and really interested in kind of walking the walk and talking the talk that we've been engaging when we've been engaging employers and when we've been engaging others in this work. This is a really exciting slide. This slide shows the slide of some of the employers who have been designated as recovery friendly. And on here, you'll see towns, municipalities, you'll see private employers, you'll see organizations that work within the community on substance use, or that have mental health, that operate mental health programs. You'll also see some of our workforce development boards and some of the program operators that operate the American Job Centers in those regions. So very exciting, very exciting. To date, we've certified 35 employers. We have 12 municipalities. We developed the toolkit. We implemented our first Recovery Navigator apprenticeship program. We also participate in the multi-state community of practice, which was initiated by New Hampshire. And we participate in LAPA's Model Recovery Workplaces Acts to support recovery-ready workplaces and initiatives across the country. And so that really is the gist of the bulk of my discussion today for this breakout, as it sort of comes to a time when I know we're going to be moving back. There's 3 contacts.
All right. Hi, everybody. Thank you so much for joining us today at our second quarterly Governor's Workforce Council meeting. We hope that you enjoyed the presentations. I want to thank you all for sticking through our technical problems, and we'll make sure that that doesn't happen again. And encourage you all to put a hold on your calendar for September 12th, late afternoon, as we will have an in-person meeting the next time, and we're very excited to see you all in person. It's been a very long time. And then for our GWC members, please be on the lookout for an email for our WIOA vote. We will need a quorum to have that vote, and it will need to be an in-person or a virtual meeting vote. So again, thank you all so much. Happy Memorial Day, and wishing you all a wonderful, safe, and fun summer.